Hello, and welcome to Appleton Engaged. I'm your host, Timber Smith, DEI coordinator for the City of Appleton.
And I'm Andy Anam, the communications manager for the City of Appleton.
And Appleton Engaged is a podcast that explores the many people, organizations, and resources that make our community a great place to live, work, and play. So whether you're a longtime resident or just getting to know Appleton, join us as we learn more about our community together.
Our next guest, well, let's just say they need no introduction. We have one of our very familiar faces, and get ready to be in the presence of some special guests today. So why don't you introduce us to them?
I am so excited about this week's guest. This is going to be a fantastic conversation. This week's guests are Chris.ROTH, sports director and 4:30 anchor for WBAY-TV, and Kstanley, manager of specialty services for Children's Wisconsin Fox Valley. Can you please tell us a little bit about your connection with Appleton and the surrounding Fox Cities area? Chris, can we start with you?
Sure. Well, I've been at WBAY since 1999, so we have been. You've seen my face around for a while here in the Fox Cities and in Appleton. Sports director since 1999, so all the Packer coverage, and then a couple of years ago added on the 4:30 duties. I anchor the 4:30 news program up there, and which is where I got to meet you folks because you won an award for this podcast, so we had you on the 4:30. Thought it was a great conversation. It's a different news program, as you guys know. It's all interview based, so we have this long conversation. It's not quite podcast long, but in TV time, if you think of like dog years, right? So we have 19 minutes of content in our half-hour news program. You guys had 6.5 of it, so that's a significant portion of the program. That's my connection to this community. I have been here for a very long time. It is my home. I have now lived in Wisconsin longer than I lived in Illinois, which is where I was raised by far. And I've actually lived in Green Bay in this area for longer than I lived in Illinois. So this is my home.
I got to ask, since you brought up Illinois, wait, what's the team? Are we Packer fans?
No. But that also, by extension, that does not mean I'm a Chicago fan. I am not a Packer fan because then I couldn't do my job.
That's fair.
Okay.
That's fair.
And I've been covering that team full time for almost 30 years because I was in Milwaukee before I came to Green Bay, and it was my job so I was at the 2 Super Bowls, 31 and 32, working for the station in Milwaukee, and then I was at Super Bowl 45 when I worked up here. So I've been covering this team for a very long time. So when you're that close and you're covering them, you're not a fan.
That's fair.
You can't be. You can't do your job.
All right. I had to ask.
That's
Inquiring minds wanted to know.
Does it make you feel any better? When I was growing up, I was not a Bears fan because my brother was, and we were exact opposites in everything we did. So
okay.
There you go.
I like it. Katie, can you please tell us about yourself and your connection to Appleton and the surrounding Fox Cities region?
Sure. I have to follow that, though. That's great. 30 years. So my name's Kstanley, and I'm the manager of ambulatory services for Children's. And I have been a resident of Appleton since I was born. I was actually born in a hospital here, so super exciting because right from the start. I grew up in Appleton, went to all the schools here, and now I raise my family here, so I live in Darboy.
Oh,
which is great.
Awesome. Okay, so you're connected.
Connected, for sure.
And to be clear, of the two of us, the one who has the more important job is her.
That is fair. Can you please tell us a little bit about your resource?
Sure. Do you want me to go first?
You can go first,
sure.
Katie.
All right. So Children's, we have a long history of Children's in the state. We've been around for about 130 years, which is pretty fantastic for an organization to be around that long. It started really early on with only 7 ladies who, they wanted philanthropy and wanted to really help kids, and that was pretty exceptional. So it came here, and most people don't know this, but Children's has actually been in the Fox Valley for over 20 years. They were at Theta Clark Hospital. We had inpatient first, and then we brought our specialty clinic here, and it's just grown exponentially since we got here.
Yeah, I would definitely say I don't think people actually necessarily knew that because there's been so much buzz recently that people are like, children is now in our region. Oh my God, this is so good. We don't have to drive to Milwaukee or anything like that.
Yeah, oftentimes I get, oh, your office is in Milwaukee, you travel that far? And I said, no, actually it's 7 minutes down the road. So I think it's really exceptional to have that right here at home in everybody's backyard now.
I think so. I mean, I've literally heard people talk about this. As a matter of fact, I think I was in a conversation yesterday where someone brought it up, and I was like, yeah.
Yeah, well, I think the facility too, opening last spring here, obviously has changed the dynamic. It's much more visible than it used to be. But to Katie's point, and I've been here, as I mentioned, for almost 25 years, but I had been doing things with children's because they're located in Milwaukee, and the station I worked with in Milwaukee would host, and they used to have a thing called the Children's Miracle Network Telethon, which was a national telethon that raised money for children's hospitals. And we used to broadcast that live from Children's in Milwaukee. That was my first connection with the hospital there. And when I moved up here to do the job, they knew that I had worked down there and done some things. So they started asking me to host fundraise or, MC fundraisers and things like that in the area and be a part of some of the events. And as we started our event, which I know we're going to talk about, the Santa Cycle, one of the things they said was, we really would like to establish more up here because we are going to expand our footprint. And they were at the time, and we were going into our 7th year, they were talking, and Katie knows this too, but they were talking about physical structures that they were going to build because they know that this area needed it. And so that's what we've seen. That has played out. And I'm not saying it's not because of our event, but that was the plan years ago, and it has come to fruition. And it's huge benefits. You made the comment that, oh, I don't have to drive to Milwaukee anymore. That sounds like kind of an aside, right? But Katie knows this too. The families that have to do this and do it multiple times a week, to take that off of them when they are going through the most difficult time in their lives,
Right.
it is huge. Yeah. I mean, you cannot overstate how important that is for these families.
Yeah, they get their family back.
They
get their time back.
Right?
And that's like, you can't put a price on that.
Mm-hmm.
It's amazing. And and we'll talk about, our experiences, but, having gone through it as a parent of a kid that has gone through children's, when you can do that for just the smallest things add up to huge relief in a time of tremendous turmoil. That's why this resource deserves all the support it can get.
We opened the news clinic only about 9 months ago, and in that time we've grown just exponentially with patients. We have over 22 specialties.
Over 22?
22 specialties. Yeah.
Okay. My question would be is like, who do you serve, but it's in the title?
Yeah. Yeah.
And what does that look like as you serve the children in our region?
Sure. So, people say kids, right? People say kids and children's but it actually, we see ranges, pregnant ladies who have to have ultrasounds done for fetal medicine, and we see all the way up to 99 or beyond. So children's actually serves everyone, which is just exceptional. And that services have grown because of that. I think even with kids who are going to Milwaukee, they can have certain services like lab and imaging. Mm-hmm. It keeps them here. We have services like Child Life, which most people don't know what that is, but they're these wonderful people who meet kids at the door, and they really take away the anxieties of healthcare, because that's scary for kids and some adults too. So scary. Like lab alone is the scariest, but then you add everything else to it, and they just sometimes don't want to walk through our doors. So Child Life is that buffer, and most people don't have that.
When we went through it, and I didn't know this until we were at the time, and we took my daughter down for a surgery, and we were at that time in Milwaukee because the facility wasn't here yet, and we learned that there is an area, they call it was either the safe zone or the no poke zone. What do you know what I'm talking about?
Yeah, I think
so. There's an area on the floors at the hospital there where the kids, and they have things to play with and toys and all these. It is an area where the kids know, because these kids are getting treatment all the time, right? And they are poked and prodded and tested and all that. But that space, when they're in that space,
it's safe.
Nobody can come with a needle. Nobody can come to take a test. They know, and it is such really so this specialized care, and I know she talked about all the age ranges, but it makes a huge difference. I remember when my daughter was first getting tested up here when she was sick. She was really dehydrated at the time. She had this bone infection, really dehydrated, and they needed to do the scan, so they had to start an IV, but they couldn't do it. They tried and tried and tried, and her veins were just couldn't do it. So they had to put her under with gas. And we were just at the ER, and this isn't a knock on them, but it's not set up the same. The gas was horrible. I mean, she's 6 years old, and I'm pinning her down, and she's thrashing all over as they try and get the mask on her. And I could smell it. It's terrifying. This is happening. Terrifying. Little things, children's flavors the gas.
Yeah.
Wow.
Yeah.
Flavors. So that little thing there that just brings a little bit of comfort and makes it less scary. And that is a very minor detail. I've talked to families before where the sizes for if the child has a PICC line, for example, which is an intravenous line that you can put antibiotics through, and that stays in there, or medication gets delivered through the PICC line, the sizes of those things for the different children, you wouldn't have that at a normal hospital in most cases. And again, it's that specialized care that makes a huge, huge difference.
We really take pride in talking to families about what they want too. I think that is one of the special things about children's is you don't get a voice typically at all other healthcare organizations. We go based off of what's nationally right. And here we have groups of families that come and talk with us and tell us like what worked, what didn't work, and we tailor the care around that. And it's really exceptional. This new building, we did just that. We asked families, what do you want to see? Adult changing tables. They're kids who are bigger. Kids don't stay small forever, right? So, patients were being changed on the floor, and that's who wants to change their kid on the floor, right? So, we really just try to integrate and listen to families and then kids too. Like, what do they like? What do they want to see? And I think that's really special.
Listening to all these conversations brings back my memories because I went to children with my son. He was 2 years old. And when the child is too, young, and as a parent, you can see he or she's in pain and you cannot do anything and you feel so helpless at that moment, and you feel like, oh, I have money, but can I help him or her? So I think children is a very special place, and for me too. And Chris, your family has been a driving force behind Santa Cycle. So why don't you tell us about Santa Cycle and how it's going to benefit children's?
So the Santa Cycle started, this will be our 7th year. It's coming up on December 9th. And as I mentioned earlier, I'd been involved with all kinds of events helping children's for years and years and years. And I would always tell people at those events, and this was before I was even married and had kids, think of it as an insurance policy. You don't know when you're going to need it, but if you do, you're going to want it. I always tell people, even to this day, have you ever heard of the game 6 Degrees of Kevin Bacon? Like somebody's in a movie and you're like, oh yeah, they were in a movie with that person who was in a movie with that person, and you can't go 6 people without finding a person that was in a movie with Kevin Bacon, right? You can play that same game with children's, and I promise you can't go 6 people without finding someone that has been touched by this resource. That's why it is so important for our state. Given that importance, given my connection to it, I had some friends who live in the Milwaukee area, and for years and years and years, I think they're 20 plus years now, they do this thing right after Thanksgiving, the weekend after, where they call it the Santa Rampage, and a bunch of people that ride bikes would get together and start in Wauwatosa. For those that don't know, that's kind of where the hospital is, although this is not connected in any way with the hospital, but it's west of Milwaukee. They'd have hundreds of people dress up in Santa outfits, and they'd kind of do a pub crawl on bicycles all the way down to the lakefront. And it was huge, and stopped track. It was great, and my buddy took part in it and everything. And it just made me think, you know what? What if we brought that here but used it as a fundraiser? Because I like to ride bikes. I got some friends that are very active in cycling communities and bike clubs, and I brought the idea to them. They said, yeah, well, I think we can do this. We can get enough people, and we do it with and fat bikes, the big fat tires you can ride in the snow. That's become more and more popular around here. So it all worked together, and we wanted to do something to give back. So we have some great sponsorship that allows us to, all the money we bring in through registration, we do drawing tickets, and we draw for 3 fat bikes. And our tickets are 1 for $20, 3 for $50. And if you've ever shopped for a fat bike, that's a heck of a deal. These bikes are worth a lot of money. So that's very popular. So all the money we bring in goes directly to Children's to help out. And each year they have certain initiatives that they raise money for, whether it be certain equipment in hospitals, whether it be facilities, whether it be programs. I know last year we did was a lot of mental health programming. Children's has really become very dialed in on the issues facing kids right now with mental health. And there was a report out last year about how many kids in school, what they're thinking and what they're feeling and things that they're considering trying. And Children's has really zeroed in on that. So that was an emphasis last year. So anyway, all the money we raise goes directly to them. And in our first 6 years, we've raised over $100,000. Last year, we did over $27,000 for probably 120 people dressed up in Christmas costumes doing a 7.5-mile fun ride through the city of Green Bay. We start and end at Badger State Brewing. We just have a good time. It gets people in the Christmas spirit, and it's fun to see the reaction of people as you're riding through downtown or on the way to downtown, and they ask, "What are you doing? What is that?" And that helps us spread the word about this tremendous resource that is Children's Wisconsin. So that's where the idea came from. They've helped my family. We wanted to give back. Turns out one of the guys that I've co-founded this with, there's 3 of us, he was a children's patient way back when. He had heart issues when he was younger, and now he's a pretty darn good cyclist, so he's recovered. We were fortunate. My daughter recovered. She's been great. It's amazing the people that come out, and they've all somehow, some way been touched by children. So we just wanted to do a fun event that remembers, as we say in our little promo and our advertising, this is the time of year where, we think about gifts in the holiday season, but our greatest gifts, right, are our kids. So remember them and help out and have some fun along the way.
That is so incredible. And Katie, why don't you tell us about what all things are available for the people of Fox Cities region from Children's Wisconsin?
Oh, sure. So the ambulatory specialty clinic, obviously what we were just talking about. We also have our inpatient services. So we have the neonatal intensive care unit, which are the itty bitty tiny little ones. And, that unit is wonderful. It gives them kind of that for life. We have the pediatric unit there as well. So the 3rd and 4th floor at Theta Clark is where they are. We also have community services, so it gives resources to families. A lot of them are free. So a lot of these events, these philanthropic events, do fund those areas. And we also have the Child Advocacy Center, which is a resource for kids who were potentially abused or neglected. Not the most exciting thing to talk about, but these events really fuel that too. Give those kids a second chance at a really good life, and a lot of services come along with that too. Therapy, the behavioral health, and a lot of those things. So just give a lot of resources in the area for those
That
kids.
is so amazing.
How does our community get involved with Santa's Cycle? Is there volunteer opportunities? Are there, other than actually jumping on a cycle and dressing up? I'm trying to remember if my Grinch costume is ready to go, because
I can honestly tell you, if it's ready and you're there, you won't be the only Grinch there. We have seen Grinches. We do hand out some fun prizes for costumes and things like that. So the easiest way to get involved, you can ride for sure. The more the merrier. That would be awesome. I mean, we had the year before COVID. So the COVID year, we did not have an event, but we did do a virtual drawing for a fat bike. And it actually opened our eyes to doing things differently, because we had tremendous reaction to that. We raised over $11,000 in just drawing tickets alone.
Wow.
And in years past, we had always done it just in person. You had to be there, you had to buy your ticket there, and then that was it. And with this virtual thing, opened up a whole new window of opportunity for us to reach people that if they didn't want to come to the event, but they wanted to donate and they wanted a chance to win a bike, they could. And that's changed. So Santa Cycle Green Bay on Facebook is the way to do it. There is the registration link right there. There's a QR code. You could do it that way. You can register for the event. You can register day of the event. It's December 9th. That's a Saturday. We are at Badger State Brewing, which is right there in the Stadium District, about 2 blocks away from Lambeau. If you're not familiar with that area, big parking lot. So easy for you to bring your bikes and get ready to go. You can register day of. Doors open at 9. Ride starts at 10. We're pretty much wrapped up by noon. You feel free to hang out as long as you want. Badger State brews their own beverages, so every adult who signs up gets a beverage ticket with their registration. We also have a custom-made Santa hat, which is blue because that's the colors of children's. So you get that with registration. If you're a kid, they do their own sodas, so you get a soda, and you get the hat. If you want to just purchase drawing tickets for the fat bikes and not be there, that's totally fine. You do not have to be present to win. You do have to make arrangements to pick up the bike. If you're the lucky winner, we will not deliver it to you. It becomes a little cumbersome, but we work with 3 local bike shops in the area, and it's very easy to do. So if you can't be there, but you're interested in this, or you just want to donate, you can do that all through Santa Cycle Green Bay on Facebook. If you do purchase $100 worth of drawing tickets for the bikes, then we have these knit hats with our Santa Cycle logo that are blue. They're very nice, that we'll send to you if you buy that many tickets. So those are the ways to contribute. We would love to have everybody come out. We've had people come out and just hang out at the event. They don't ride. They just want to be a part of it. Hear some of the stories. It's a lot of fun. We think so anyway, and we hope a lot of people will hear this and think it's fun and come out and join us.
So it's on December 9th, right?
Yeah, that is a Saturday.
It's a Saturday. What time does it start?
The doors open at 9, the ride's at 10, and like I said, we're pretty much done by noon with our festivities, and then, everybody's welcome to hang out at Badger State as long as they like. But we know people are busy. It's a couple weeks before Christmas. There's a lot to do, so.
Katie,
Yeah.
is there ways for our community to get involved directly with children's?
Yeah.
Is there volunteer opportunities there?
Yeah, there is. So our community services, we actually have a volunteer coordinator position where he gets volunteers involved. And then a lot of times they can work in the hospital in the NICU. They can work in the pediatric area. We do have shifts within our clinics too. They really help with anything that we need. So sometimes it's just stuffing folders for us and keeping the nurses going in the clinical care. And then sometimes it's holding babies. So a lot of times if people want to get involved, if it's only an hour of your time, that's okay. They will get you involved somehow, which is really great. So we really encourage people to volunteer because it's a great service, and you can, like I said, who doesn't want to hold a brand new baby, right? or color with kids. So we can always use those.
When you said that, I literally think I just felt my wife's presence, like baby holding. Oh my, I am there.
Yeah, we have some babies just need to be held for the entire shift, and they actually will rock them, walk them, all that stuff. So when I found that out, I was like, I will volunteer too.
Can you please share a story with us that helps the Appleton Engage listeners understand the impact of children's?
I don't know if it's one particular story. The Kevin Bacon reference, I think most people would understand that. We had a gentleman at one of our events a couple years ago, and I had my daughter. I have 2 daughters. She was 6 when she went through children's. She's now 23. So this was a couple years ago. I think she may have been a senior in high school, and we had some of their friends out volunteering, helping us. And so they were walking around, and a gentleman that had participated, an older fellow, came up to me, and he said, really, he was talking about how grateful he was for the event and also for children's. And we talked for a little while, and then he moved on. And then my daughter came up to me later and said, Dad, I didn't know what to do. This guy came up, and he started telling me how happy he was that I recovered and that I'm okay. And then he started crying, and he had lost his daughter to a disease years ago, and she had gone through children's. And even though that didn't turn out well, he was so grateful for the time that care and treatment provided them to have more time with her. And he wasn't bitter. He was happy that my daughter had recovered. And she said, I didn't know what to do. And he asked if he could give me a hug, and I said yes. And I said, okay. I said, well, Ellie, that's that's why we ride. That's why we do this.
That's so touching.
Yeah.
That's so touching, Chris. Yeah. People say that the honest prayers are heard in the hospitals. And, at that time, the doctors and nurses, they are the real messiahs, if you see. That's where your child is there with them. And now you have to put your all faith. And they at that time, I remember seeing them as God at that time. And they did fantastic job. Children's does fantastic job with the kids. And, you as a parent, you feels like my child is in safe hands. So congratulations for that.
Yeah. We, I haven't always been part of children's. I've only been with children's about 4 years. And recently we just started doing the Connected for Kids. It's the partnership with Bellin and Data Care. And I had the pleasure of listening to a mom stand up on a podium and tell us about her 3 kids and how the first child had been diagnosed with some auditory issues, and it really affected vision and hearing. And she spent a lot of time missing work and taking the kids to Milwaukee and missing her youngest kid's time, missing that baby stage. And, some of the kids missed school. And then she said, then her second child was diagnosed with the same thing. And, it was mind blowing that we could bring these services to the community here in the Fox Valley and connect with other organizations who want to be able to be part of that and give to kids and make sure that families can be home and have their time together. And I think that's so important. And I am so proud to be part of this organization and what they're doing for kids and families. Like, it's just really that time. You can't get that back. So
Absolutely.
Katie, who can people reach out to if they need to connect to children?
Sure. So if it's really anything clinical related, they can call our local number, which is super easy. It's the 969-5353. It's super easy to remember. That line can get you to all kinds of clinical services. But if they really want to get involved, our community service line on our childrenswisconsin.org website, that's on there for families to connect to. And then also our marketing department too. So if they want to be part of any events or get involved that way, they can reach out to marketing on our webpage as well.
So is there, if people need more information on the Santa cycle, who should they touch base with? You, Chris?
Sure, they can contact me at WBAY. The email is easy to find on the website. Our information is very easy to find. If you're a Facebook person, like I said, Santa Cycle Green Bay, and everybody's welcome. We'd love to get to the point where we really, really back up traffic. The mayor of Green Bay and his dad have ridden with us for the last couple of years. So he's totally fine with it if we totally mess up traffic on Saturday morning in Green Bay. A couple of years ago, we had a drone. I had a guy shoot some drone video for us, and we got stopped. And for those who are familiar with Green Bay, we were on the west side of the river on Broadway. We were stopped at a light, and the bikes, and again, almost everybody's in some kind of costume, tons of Santa costumes. So we probably had 100, and I don't remember what it's at, 140 riders, something like that. But we were stretched out for 2.5 blocks.
Wow.
Nice.
It was great. And it had snowed that morning. People were out shoveling. I had I think it was last year. We had snow. I think it was last year. We had a lot of snow in the morning, and it was terrible. And it was 2 years ago. I woke up in the morning to go over and set up the place, and I was driving across the river on 172, and you couldn't see the other side. It was coming in sideways. It was blowing really hard, and it probably hurt us because people thought they weren't being able to drive and get to the event. But it had cleared up by the time we rode, so everybody was out shoveling, and we went by. And again, it's a long line of bike. We string it out. We don't block both lanes of traffic, and the front end of I was riding on the trail end, just to make sure we didn't have any stragglers. And the front end must have passed by, and this guy was out shoveling one of the bars on what street we were on, Broadway. And as I passed, I kept going, all of a sudden I hear this guy shouting. He's like, wait. And he runs down, and so I stop, and he's running down, and he's waving. He's got a $100 bill in his hand. And he said, oh, yeah, they told me what you guys were doing. I just want to donate this. I'm like, oh, hey. And he's running through the slush and the snow, right? He's he's got a shovel. I think he may have had the shovel in one hand, but he's got $100 in the other hand. But again, it goes back to what I said earlier. You get this site, people ask, what are you doing? They hear what it is. They want to be a part of it. And that's just an example of that.
That is fantastic.
Yeah.
Is there anything that we didn't ask that you would like to share with us at this time?
I think I guess I can put a plug out there. So, the Santa Cycle is only one event of so many that are out there for children's. And, even myself living here, some of them I didn't even hear of myself, and have been around for 15, 20 years of that, like donating and fundraising. There's the Santa Cycle. There's the, we have what's called the WFCA All-Star Football Game. So local kids from all over the state get to play.
The
local
high school
schools.
all-state teams get to play.
There's 6 teams, which I didn't realize, but they raise, couple $100,000 every single year. I think last year was like over 300,000.
Yep.
So these kids really, it's really impactful for them. They get to be part of it.
They used to visit. Do they still go visit? Some of the teams will go visit some of the kids in the.
They do. They
So
do.
that's in July. Usually they have the big golf outing every June.
Yep, they have the golf outing, and then the Gather for Good, which is typically in the De Pere area. They do that once a year too.
Yeah, we had that in October. It was up in the Green Bay area.
So do you want to give a shout out?
Yeah, I think, obviously thank you to the people like Chris who put together these fundraisers for us, because without them, we can't bring services to the Fox Valley. We had a goal, a 10-year goal to bring $30 million here to help out, to be able to bring these services. And without them, we can't do that. So that's really awesome. And then, of course, our providers, we have providers who give up their time too. We actually have over 50 providers that drive up from Milwaukee. So, they're a big part of that, and it's the thank you to them, which typically gets lost. The thank you comes to the families, but we really, having the providers here is so great. And then, of course, our staff and the people who are keeping the business going and those buildings. You don't see them, but there's a lot.
Heroes.
There's a lot of heroes.
Yep, for sure. I should mention our sponsors for the event. So Albert and Shirley Schmidt, huge supporters of Children's Wisconsin. They're a presenting sponsor, along with Nature's Way Vitamins, which is headquartered up in Green Bay. Nicolay Bank, Festival Foods. They've been with us since the very beginning. WBAY-TV, obviously. And then our bike shops, Pete's Garage, Broken Spoke, and Stadium Bike are big sponsors. But this is going to sound a little weird, but for the families out there, I think they deserve, the kids themselves. Children's a couple years ago did the superheroes with all the patient kids, which was awesome. And they're superheroes. They're so brave what they go through. The families too, right? Because they're going through it, and siblings. Some of the siblings come through this. Just another quick anecdote. So my daughter was 6. My youngest was 4 at the time. And she was terrified, right? And when my daughter came out of surgery and she was in the recovery, once they got her into a room, they let her little sister, she got ice cream with her. She got to take a nap with her. Denise, who works at Children's, longtime friend of mine, came to visit, brought them both stuffed animals. I mean, they treat the patient, Children's does, but they treat the entire family at the same time. If you've experienced it, you know what I'm talking about. Yeah. If you haven't, I hope you don't. But if you have to, this is the place.
Yeah. The families really are special, I think. So we have these big, beautiful murals in our new building. And in the very beginning, we had families, providers, patients come and paint that mural, and with a local artist who actually paints downtown Appleton here. So he's got a tie in this building as well. But there's one family who was just really was like the definition of what he just said. They have 2 adopted children. They have 3 of their own children. And those children that are the 3 of their own, they really they just embraced everything about children's. They helped their siblings who couldn't raise their hands to paint the walls. And it's amazing to see that it affects them, but it affects them in a really positive way because of Children's and how we really include them all.
Thank you. It's that time. We're going to start wrapping up this episode. Appleton Engaged listeners, we just want to say thank you, thank you, thank you. Thank you for spending time with us. Thank you for listening. Thank you for giving us your minds for a little bit of time. we are a work in progress. So we are always letting you know, please reach out to us and let us know how we're doing or how we can improve the show. Also, reach out to us if you'd like to be a guest, or reach out to us if you want to suggest a guest. And the best way to reach out to us is at diversity@appleton.org. Once again, that is diversity@appleton.org. And we have one more request for you listeners, and that is please subscribe to the podcast. Take a moment, just subscribe to the podcast, and also leave us a review. What this does is it helps our analytics improve, and we think we have something pretty special here. So it helps more listeners find this very special podcast.
Appletonians, please do sign up for Santa Cycle on December 9th. Please mark your calendar, save the dates, whatever you need to do, you need to show up and support the cause. So thank you, Chris and Katie. You are incredible. You have harnessed your passion and channeled it into an action. And that's what we love of our guests who come to these podcasts. Thank you for sharing your passion and every great thing you're doing for the community. We are thankful. Thank you. Until next time, stay thoughtful, stay curious, and stay engaged.